Hi, this is Dr. Jonathan D. Hall coming to you from Boston with another episode in a thoughtful patient's guide to plastic surgery. Today I'm going to talk a little bit about earlobe lifts, and we'll call this giving your earlobes a lift. Before we can create a beautiful earlobe, we need to understand what the normal beautiful is and the earlobe deformity that we are correcting. The question of what makes an earlobe beautiful has been studied in some depth, and plastic surgeons love science and math and have done the scientific research to answer this question. I went into detail about the research and science of what makes a beautiful earlobe in my video on creating the beautiful earlobe. In most parts of the human anatomy, beauty is associated with youth. Our goal as we look at an earlobe problem such as a split or gauges is not just to repair, but to create a beautiful earlobe. In my other presentation, we learned about the aging earlobe deformity, and we learned that earlobes get longer and narrower with age in both women and men. And to better understand what is considered to be beautiful in an earlobe, we reviewed a study where men and women were asked what they found to be the most attractive in an earlobe. In this study, earlobes of varying dimensions were placed on life-size drawings of male and female faces that were judged by other studies to have the most attractive measurements, and 131 men and women observers were asked to rank which earlobes were the most aesthetic. Their choices were ranked in order of preference, and the choices were remarkably consistent across both female and male faces and observers. We learned that the most attractive earlobe, according to multiple observers, is the youthful earlobe with an overall height of 15 millimeters and a free caudal border of 5 millimeters. We also discussed anatomic terms. We can't look at the body as north or south as we're referring to different parts of the body, but we use cephalic, meaning towards the head, or caudal as towards the tail. So the free caudal border of the earlobe is the part that hangs down from the cheek where it's attached. And so the most attractive free caudal border is 5 millimeters, with the second most attractive being as much as 10 millimeters. Once we know what is beautiful and analyze a given earlobe, we can better understand how to make it more attractive. It has been said that one key does not fit every lock, and there is not one technique that works for every earlobe. I analyze and tailor each earlobe procedure depending on what tissues are available, with the goal of restoring a more beautiful appearance. Many different methods have been described to correct an earlobe that is too large. We can place the incisions at the front edge of the earlobe, as shown in this slide, with multiple different methods that have been described. Some other methods place the incision at the back of the earlobe, and this shows some other methods that have been described to reduce an earlobe. But oftentimes, the simple methods are the best. And here is a simple method described in the Plastic and Reconstructive Surgery Journal in 1985, where a wedge is removed from the ear, placing the scar at the lower border. This is my preferred method for most earlobe lifts. In the photography above, the pen represents an imaginary point, and we swing the earlobe back and forth to precisely mark the wedge that is to be removed. This is a similar process to how we might mark a breast lift. We can see the before on the left and on the right 3 months after, just after re-piercing the ear in the office. As we look at a few patients today, it's important to note that scars typically become thicker and redder for 6 weeks after repair, and then soften and fade over the next year or longer. Most of the photos that we will look at are around 3 months after repair, which is the typical time I recommend waiting before re-piercing the ear. And in this picture, we see a woman in her early 40s who's bothered by drooping of the earlobes. When we re-pierced her ears, she was so happy. She said she felt like she was in the 7th grade again and getting her ears pierced for the first time. Here's another woman in her early 40s who feels that her earlobes are droopy. She is shown before and again 6 months after an earlobe lift, and we can see the scar has even faded a little bit more at 6 months than at 3 months. And here's a woman in her 60s who's bothered by a low piercing on her earlobe, as well as a droopy appearance. She's shown before and again 15 months after surgery, and we can see the scar is really faded and difficult to see. She told me the story that she'd originally had her ears pierced with an ice cube, a needle, and a potato when she was 13. It is my belief that we shouldn't just repair an earlobe, but we should strive to make it more beautiful as well. Here is a woman in her 60s who had her earlobe split repaired in Boston 8 years before, but without a lift. She tore her earlobe again and came in to me to have it corrected. She was so thrilled that we not only repaired this, but also lifted it and made the earlobe more beautiful in appearance. And I have recommended that she not sleep with her earrings in to prevent this from splitting again. I have another video on the split earlobe that talks about the different causes for splitting of the ear. This wedge method is versatile and can be creatively arranged to remove a slit, a split, or both a slit and a split, as we see here in this woman in her early 70s. When there is enough tissue and the splits are not too far apart, the wedge of the lift can be used to remove a double cleft, as shown here in a woman in her 60s. She's shown before and 3 months after correction. We have fixed her double split, but also given her a beautiful earlobe shape at the same time. Here is a nurse in her 20s with a history of gauges. She did not like the droopy appearance of her earlobes and wanted to have a normal earlobe for her wedding. She is shown before and again 3 months after earlobe lift combined with correction of the gauged hole. Here's a man in his later 20s with gauges of his ears and a droopy appearance. He's shown before and again 3 months after. He does not plan to have his ear re-pierced. Correction of gauges can be challenging, and I have a separate video devoted to this topic. So we know that earlobes get longer and narrower with time, but there are some patients that simply have oversized or hypertrophic, which is a medical word for an oversized earlobe, from a very young age. Here's a man in his 50s with prominent, floppy, hypertrophic earlobes. He was teased when he was younger because of the size of his earlobes. He is shown before and again 3 months after earlobe lift and reduction, with now a normal proportional appearance of his earlobe. Here's a woman still working in her early 70s who is bothered by floppiness of her earlobes as she has aged. She is shown before and again 6 weeks after an earlobe lift. Here's a woman in her early 60s who felt like she has her grandfather's ears, especially when she added the weight of an earring. She's shown before and again 3.5 months after an earlobe lift. Here's another woman in her 60s shown before and 3 months after a lift, and we can see the shape of her earlobe before, which is longer and narrower, and after with an attractive, more youthful shape. Here's a woman in her later 50s who's bothered by enlarged piercings that let her earrings fall out, as well as a drooping appearance of her earlobes. She's shown before and again 3 months after a correction of the split combined with an earlobe lift. Here's a woman in her early 50s with a partial split of her earlobe. Her earrings fall through, and she's also bothered by a drooping appearance. We can see that the earlobe is both narrower and longer and looks more like an aged earlobe. We can see that in addition to correcting the split, our lift has corrected this drooping and changed the shape of her earlobe to a more youthful appearance. Here's a woman in her later 40s with a partial cleft of her left ear and a drooping appearance of the earlobe. She's shown before and again 5 months after earlobe lift combined with a cleft repair. And a woman in her later 40s bothered by a drooping of the earlobe, shown before and again 3 months after. And here's a woman in her early 40s with a slit and drooping of her earlobes. She is shown before and again 4 months after a correction with an earlobe lift. We can see from the redness and peeling in her ear that she probably has a partial split from an allergy to her earrings, usually to nickel. Again, I discussed this in my video on split ears. Another lift to correct the shape of the earlobe and correct the split. Here's a woman in her early 30s with a partial split and drooping of the earlobe, shown before and again 3 months after repair of the split combined with a lift. So again, earlobes get longer and narrower with age. And even though this woman is only in her early 30s, we were able to give her earlobe a more youthful and aesthetic appearance at the same time as correcting the split. If we'd simply excised the split and not done a lift, her earlobe would be longer and narrower. Here's a woman in her early 30s with a partial split of the earlobe and a drooping appearance, and she's shown before and again 3 months after correction of the split combined with a lift. Another woman in her later 30s who's bothered by partial split that causes her backs to pull through, as well as early drooping of her earlobes. She's shown before and again 3 months after an earlobe lift combined with correction of the split. So this is a procedure that's easily done in the office. We mark the surgical repair and clean the ear with antiseptic and then place a buffered anesthetic. Procedure takes generally an hour to an hour and a half and uses multiple layers of dissolvable sutures, and a Band-Aid and ointment is applied. The next day we have people shower with gentle soap and apply Aquaphor ointment. With any earlobe repair, it's important to protect it for 6 weeks while sleeping. When we repair an earlobe, it actually does not start to get stronger for at least 3 weeks, and then slowly between the 3rd and the 6th week it regains enough strength so that by 6 weeks it's at 70% of the final strength. If a patient sleeps with their ear against the pillow without protection and moving back and forth, we can get a gaping of that repair and will not heal as well. It's also important to protect the earlobe repair from ultraviolet light exposure for 6 to 12 months to prevent the incision from turning brown. This is especially important in patients of color. Well, thank you for listening. This has been Dr. Jonathan D. Hall talking today about earlobe lifts. Hope you've enjoyed my presentation. And if you have any further questions, please call us and check out our other videos on earlobes.